Hello, thanks for joining me. Um, so this week we've been focusing on the Fatal 4 or 5 plus protocols that are written to protect individuals that are supported by direct support professionals and caregivers. And so just in review, we discussed aspiration, pica, constipation, dehydration, and diabetes. And so the other one, there's a couple things I want to address today, and that is seizures and then behaviors. So seizures are very specific. Oh, and by the way, if you've not joined me before, I'm Shar Meekins. I'm a developmental disabilities nurse who has a passion and desire to mentor other nurses, train direct support professionals, and support agencies, families, and individuals with DD. So thanks for joining me, Sharon. Um, Good to see you on today. Okay, so let's talk about seizures. Seizures are not uncommon for individuals with developmental disabilities. And so it's really important to know each of your customers and know what their seizure patterns and triggers are, because that's how we're able to best support them is by prevention. Not that you can prevent all seizures, but the key points are making sure they get their analeptic medications on time as scheduled, and making sure that you avoid the triggers that are theirs. Like, for instance, I have a customer that if he has to focus too much on eating a meal, focusing on silverware and concentrating, it can trigger a seizure. Or I have several customers that have seizures. So the biggest issue is making sure that we're treating their seizure and following up with their physicians. So there's not a lot to say about seizures other than keep the customer safe when a seizure starts. Make sure you're timing that seizure. You're moving all the materials around that individual to prevent them from injuring themselves, and that you're making sure that their airway is open, that they're breathing actually during the seizure activity, and then making sure they're comfortable after, especially after the seizure. Oftentimes they're fatigued. They need some time to rest. And then other times it's normal. It's a normal day for them, and they just pop right back up and they're back to their activities. So it just depends on how long the seizure is and what's involved, or even the type of seizure. All right. And then the other thing I want to talk about today is behaviors. Behaviors are a source of communication. And as we as support professionals, are we listening? I think too often, if someone is having a behavior, whether that's a child or adult with developmental disabilities or someone with mental health, we're quick to label it behavior, and we go back to their psychiatrist or their mental health provider that prescribes, and we think that medication is going to fix it. And that's a really poor decision to make so quickly. You definitely need to take time to review the behavior and what they're trying to communicate through that behavior. For instance, I've been taking a training for caring for DD individuals, and we were discussing last night head banging, right? So we might see head banging as a form of aggression and a behavior, when actually there's a lot we need to consider. We need to consider, do they have a headache? Do they have sinus pain? Do they have ear pain? Do they have teeth pain? sometimes, do they have a migraine? Sometimes we're not thinking outside the box when it comes to head banging. Maybe it's they've chosen not to eat, and or there's so many things. Maybe they're biting their arm. Maybe they're involved in some behaviors where they're self-injurious. But there's been examples of someone that was biting their arm and years later realized that it's just like a child when they're teething, right? They want to bite on something. Well, this particular individual was having a lot of teeth pain, and they were biting themselves to relieve that pain. And once they got in for some hospital dentistry, they were able to extract the teeth that were causing pain, and the biting stopped. Maybe it's a behavior and curling up in a ball and groaning and crying out and being irritable and aggressive, as we talked about the other day, just because of constipation, chronic constipation, where their bowels really never are emptied completely, and it's just made their lives miserable. And when they're finally treated properly, then you can be a lot happier, right, when you're not constipated. So my challenge is to make sure that you're looking at behaviors as a way of communicating, not just as a mental health breakdown or aggression, but really looking at the circumstances so you can address the medical issues first and then address the behavioral if it is a mental health. But it could be a UTI. It could be any type of infection. It could be pain. I've known customers that break their foot and walk on it for several days before anybody realizes that they've actually have a fracture. So I know some pretty tough individuals with DD, and their pain tolerance is up to the sky. It's unbelievable, and you may not even see a difference in their face. So anyway, so that closes my week out, and next week we'll come back with some new support ideas for individuals with DD. And I appreciate you joining me, Sharon, and we will be talking next week. Have a good night. Bye.